I don't want you to go.
So I've seen this play out before. What's going on, YouTube? Welcome back to the channel. Tonight we are taking on ER, Episode 2, Season 1. I am Dr. Todd, by the way.
I'm Allycia.
Thank you so much for being here. For those of you coming back, if you are here for the first time, I'm an internal medicine doctor, and we are breaking down the OG ER. Please consider hitting that subscribe button if you are new around here. Like, comment, all those things. We enjoy interacting with you guys on this. Excited to jump into this episode and see. Obviously, we learned a few things from the comments, and you guys, we might touch base on that a little bit throughout the episode, but really just excited to get in and see some more.
See some more Baby Robbie.
Baby Robbie.
Carter, Dr. Carter.
Baby. Well, yeah. So one person did say that they do not view him as Baby Robbie. They view him as a grown-up Dr. Carter.
I know.
Depends what you watch first.
Like when they watch The Pit.
Right.
Yeah.
So whatever you watch first. But anyway, Baby Robbie here, back in action. All right, guys, we're going to jump on into this. Any thoughts, Allycia?
Nope.
All right,
there you go.
Let's
Get
do
it.
it. Subscribe.
Susan, the baby
Davy.
in respiratory arrest.
Is she OB? Oh.
Oh, no.
1-year-old found unresponsive in crib.
Gosh.
Has she been sick? No. Any medication?
She was like gray. Okay. She looks like a real baby, like live now. She choking? Because it looks like she's doing the Heimlich.
Well, back thrust, which is sort of the pediatric version of the Heimlich.
Yeah. We got a story about that.
How I saved your life.
Oh, not just mine. You did our middle child too. You had to perform the Heimlich on me and her.
Remember that.
Biscuits. She had like,
Stay tuned to the end.
write that down.
An earring.
An earring?
Ventilator. Blood sugar 20.
Dextroside.
Okay, got it.
Couldn't tell if they were saying dextra.
Dextrose.
Oh, okay.
Fluid.
Okay. All right. All right. Baby's crying.
Get a blood gas, chest, film, CBC, and Chem7.
I assume they want to make sure there was no aspiration.
Well, yeah, I mean.
I don't know if that's
you're
what
gonna
those
cover
tests
your-
were.
You're going to cover your bases now.
I bet in 1994 they didn't have the blue line that indicate whether they peed or not on those diapers.
Actually, one thing before we get too far into this, last episode, there was a kid who came in with a presumed stomach ulcer, and I was really hoping they would dive into that because I kind of had a lot to say about that. They really didn't. They really didn't button that up. So so stick around the end because I'm not going to like derail it too long right now, but I want to talk about like stress and this sort of myth, if you will, the misconception that stress itself can lead to stomach ulcers. Because you'll hear that a lot, like, oh, it's probably just the stress I'm under. There is such a thing as stress ulcers, but it's not quite mental stress. And so we'll talk about that at the end because that is something obviously we see and treat. And
Why don't you write that
you know,
down so you don't forget?
Oh.
For hours sleep, you should be thanking.
I know, but
We didn't need you for the baby. Now we need you.
Is he a resident now?
No, well, I don't know. Actually, I don't know how far we'll.
Some Hofbräu house on 46th.
Oh, food poisoning.
Oh, what the heck? There's a lot of them.
Stool wax.
A lot of.
Stool guaiacs. So he used to do the fecal occult stool test.
5 is a kid with an allergic reaction.
Where's the guy with the hand?
Dr. Green.
please. You got 4 coming in on the chopper. 2 clinical. How soon? 5 to 10. Okay.
Too clinical.
Critical.
Critical. Okay.
If you're coming in on a chopper, you're probably pretty critical.
You ever been air flown in a helicopter or a hospital?
No.
Me either. I count myself lucky on that.
I think we're all pretty lucky if we don't end up on a air care.
I thought you had to air care for your scar.
No.
Fredo's going to poke you in the eye.
What you were doing.
Good morning, Mr. Zambano. I'm Dr. Lewis. This is John Carter. In order to evaluate pain, start with PQRST.
PQRST.
So, what brought on your pain?
I was in a shower and it just started.
Could you describe the pain?
Okay, so they're referencing like a mnemonic basically of like how to ask questions.
Oh, okay.
So
PQRST. Okay.
mnemonics are extremely common devices in medical school. That's like obviously how you remember certain things. The one that we had in medical school was like some really long, like nildo caveat or something. It was like nature, intensity, location, duration, association, alleviation. I don't even remember them all, but it's kind of how to keep your check if you're asking questions and you kind of get stumbled, maybe like how you can revert back to a system. That way you don't forget things. There's different ways to look at it: the head to toe systems, working systems, and then of course you have these types of mnemonics.
Yeah.
But that's what he's referencing, or what she was referencing with that.
Your EKG's normal, your pain subsided. In your history of angina, I don't think we need to be too concerned. Dr. Carter will keep an eye on you while we wait for your enzyme results, okay?
Troponins.
Oh, okay.
So checking troponins to make sure you didn't have myocardial injury, which would release troponins.
Yeah.
You check more than one because you have to measure it over time.
Yeah.
It's been 8 weeks.
8 weeks.
There yet?
Talk about it. Still haven't done it.
You and Hathaway were so close.
Oh, they're talking about the nurse that OD'd.
Oh, yeah.
Gonna get any easier, Doug.
Just go.
Oh, he hasn't visited her.
In 8 weeks.
Oh, he's got to have a chopper scene. I just hope they're not bringing out a limb.
Having some PTSD. From the
Yeah.
pit.
This reminds me of Baywatch. I don't know why. I'm just getting Baywatch images or Baywatch vibes right now. I loved that show in the 90s.
I think everybody loved that show.
We probably loved it for different reasons.
I always enjoy shows with people saving people.
Okay.
And Pamela Anderson.
He's got sunglasses on. Just like,
You take her into two. Doug, take the little girl into one.
oh, there's a little girl.
I can believe it.
Well, at least she's
Yeah,
like
she's-
screaming. So
yeah.
that's
And 1, 2, 3, go.
a good sign.
Let's get the old neck moving now.
So transfused blood, ONEG, universal donor.
He's down in here.
Did they say what if it was like a car accident or something?
I'm
I
not
might not have
sure.
heard it. Yeah.
Right here? How about here?
Yeah.
You are now. Okay, just stay really still, okay?
So probably a splenic laceration based on what they're saying.
Like from a seatbelt or?
Oh,
that
you
would-
could.
Yeah.
It could be. And that can be very dangerous. So you take her to the OR to remove it.
Yeah.
Yeah.
Wonder why they're handcuffing him.
Too bad.
We'll need blood alcohol.
Bet is over 200.
So it's
It
just
was
like a drunk driver
yeah.
situation.
Get a tox screen and a CT of his head.
And the mom's gonna die.
You done this before?
5 times.
I mean, man, she's hitting that pretty hard.
You got to check it.
I know. I'm like, ow.
My wife and daughter all right?
We're working on them right now.
Didn't even see him coming. The light changed, Janet screamed and...
Mm.
How many more do we have?
3.
3. Let's check on a patient. I'll be right back.
I mean, food poisoning is not funny. It sucks.
Yeah.
How much longer am I gonna have to wait?
Just a couple more minutes. We are very busy today. But you feeling all right otherwise?
Doesn't look like he's.
Zambano.
Oh no. Now he's coded. That's gonna be his first code.
Oh, damn, Mr. Zambano!
Start those chest
That's
compressions.
about right what I was
Robbie.
about ready to say. You
I'm
said it
sorry,
first.
Carter. Sorry.
Did you say Dr. Rob?
Yeah.
You can't just leave him there? You gonna run a code by yourself? You can't do that. Can you?
So you do what you can do, which
Yeah.
would be chest compressions, breath, and
What is he doing? What?
okay. Well,
You need help?
I'm here. Are vital signs stable? Yes. So you're gonna be just fine.
I do appreciate though, like this is the second time we've seen him like just sort of jubilated with like
Yeah.
we just what we did, like sort of that thought process of what we did here was amazing. And in this case, what he did here, but the last one was delivering the baby, I believe,
Yeah.
right? And just like bringing this life into the world, like you could just see like he was so enamored by it. And then this is actually really cool, and I love that his character seems to be really passionate about this because I've mentioned this in other shows. At the end of the day, this is why you do it. Like this is is why you do what you do, because you have the ability to actually make a difference. Like if he wasn't there, he's a student,
Is
for
he a
Christ's
student?
sake. Yeah.
Well-
Yeah, he's a third-year student. If he's not there, in theory, right, based on the way this
Yeah.
show is written, that patient's dead, right?
Yeah.
And so this guy gets to live, frankly, because student Dr. Carter was there, based on the show, of course, based on
Yeah.
the way this is written. So anyway, that's really cool, and he seems to be really excited by that.
Do students have long coats though?
Not typically.
Oh, okay.
I mean,
All right.
yeah, not typically.
Right.
You gonna make it?
Ruptured spleen. How's the father?
Orthopods are doing his leg. The driver's sleeping like a baby, not a scratch on him.
I love how they call him an orthopod.
Yep, that's coming.
How's the mother?
Oh no.
Maybe.
Okay.
8 weeks since she attempted suicide.
You and Hathaway shared a lot of things.
I stopped by a couple of times. Never got out of the car.
Take her some flowers. You don't have to stay long.
Oh, so she's home.
You want me to go with you? I'm off Sundays. That'd be a good time.
I don't know.
Whose pager is it?
Yeah.
You know, I completely forgot this was set in Chicago.
Oh.
This was not intentional.
No older than my grandson. 12 maybe. With a little gun.
Oh wow.
Store. Robbed 7 times. Never hurt. Nothing. Now I get shot by 6th grader with baby gun.
I'm gonna send you up to the OR. They'll explore the wound for any serious damage, remove any dead tissue and debris.
You like cognac? I can get you a good cognac. Smooth as silk. Good doctor, eh? He's the best.
The best, I was going to say. The best.
For slight productive cough, postural hypertension, and he's dehydrated.
Postural hypertension. Blood pressure drops when you stand up or sit up.
Still, why don't you lie back right here? Hey, Malik, we might need some restraints over here.
I have to feed my dog.
Okay, yeah.
Oh.
Get like services down here for a consult. Do a GGF1.
TGF1?
Grandpa's got a fever, CDC, Chem 7, chest x-rays, you're waiting blood cultures ×2.
Yeah, so I was gonna say I don't know if this patient maybe has like baseline cognitive deficits,
Okay,
or
yeah.
this is like a new onset. So I don't think this is necessarily. I think most people are aware of this, but urinary tract infections are probably number one always on your list of altered mental status in an elderly individual who was otherwise normal. Like,
Okay.
especially something acute. You're gonna think of something like that, or an infection in general, sepsis,
Yeah.
whatever could certainly do it. Pneumonias, things like that could do it as well. So that's kind of what you're going at. Now we don't know. I don't know baseline, so I don't know if that was discussed, but that matters too.
Yeah.
65-year-old male with severe peripheral vascular disease manifested by claudication of the left calf. He's 10 days post-op from Mercy General after having an aorta bifemoral bypass. Normal post-operative course until about 6 hours ago when he began to experience the gradual onset of lower left quadrant pain without palliative or provoking factors.
Did you catch that?
Quadrant plane on the left side and
So basically what he said is you got this 65-year-old gentleman who was having vascular claudication. So basically soreness in the leg with exertion. He was found to have significant arterial disease, so a lot of plaque buildup in that artery. So he had a bypass procedure to essentially exactly that, bypass the area of
oh, okay.
plaque or of obstruction.
Or did he
in the
say
valve.
claudication?
Well, that's the symptom.
Oh,
but to
okay.
bypass that area of occlusion in the artery. And so then he developed post-op complications where he's now having left-sided pain, but does not seem to be made worse by palpation. And there doesn't seem to be alleviating factors. There's not anything making it better. That's what that is.
You know what I think's crazy about that?
What?
This anime that we're watching, Dr. Stone, you can't remember the character's name yet. You interpreted all of that.
Well, because this is the type of thing that I get presented to me. Like, so
I know.
like
Which is
students
funny.
or residents, like they come in and they're telling you all this stuff, and that's like you're thinking through it as he's going. So yeah, that's
It was just funny.
Meds.
30 cc's milk of magnesia, constipation.
You? The mother's maiden name?
He's joking.
that means you
See,
did,
it's a name. You can't remember it.
that means you did a great presentation when he's nitpicking something like that you
Yeah.
don't need to know.
Cap refill is normal.
My leg is fine. My stomach hurts.
Dr. Carter, what would you do?
In view of his history of constipation, the diffuse nature of the pain, I'd order a CBC, M7, UA amylase, and a KUB.
It's a pretty good start.
Yeah.
I'd discharge him. Let him follow up with his personal physician.
Congratulations. You just cost this hospital a $2 million malpractice settlement. You could have a thrombosis at the graft site with potential extension into the renal or mesenteric arteries.
Clot.
He's like, blood clot.
Shouldn't we wait for my doctor?
No, I don't think that'd be wise. Let's notify radiology and get him on it right away.
I mean, I probably wouldn't mention malpractice in front of a patient,
Yeah.
but
Thrombosis.
I mean, come on. You're not going to get it all right your first time.
The blood alcohol came back at 435. There's no justice, is there?
Not much.
So he did have alcohol, right? Alcohol?
No,
Yeah.
he is. Blood alcohol is through the roof.
I didn't hear that one.
He's dehydrated and has a slight upper respiratory tract infection. The fluids help, but he's still
Upper respiratory.
Did you run a CAT scan?
diffuse atrophy. Nothing new or focal.
Todd here.
That's it?
Give him 2.5 Haldol and have social services do a follow-up. I don't have a bed for him. Find him a medical bed or release him. I'm not admitting him. End of discussion.
Yeah. Woo!
So this is actually a pretty common thing in the hospital. So that
Is it?
We
We get to see a burn patient. I mean, like a sunburn.
but the like this sort of jockeying back and forth between admitting services and like you will
Like,
see
that's
this.
normal.
Like yeah, it's not uncommon. It kind of can feel like patients get punted a lot.
Yeah.
Because it's like nobody wants to take him, nobody wants to take accountability here. You know, I don't work in the psych arena very much, so, but I do know that like this patient doesn't appear to need to be admitted for medical reasons. And so
Yeah.
that's the thing. Like, so an upper respiratory infection could be treated typically outpatient unless you have a high, like, you know, there's something called CURB 65 score, which is what we use to determine like mortality rates in people with pneumonia. And so like you might, but he doesn't seem like he has pneumonia, but the idea though would be you could apply this like CURB, so confusion, uremia, respiratory rate, blood pressure. If these things are abnormal and over the age of 65, which he is,
Yeah.
then you could make a case for hospitalization for medical management. This patient seems to have dementia. Do you admit every patient with dementia? I guess that's a difficult topic, and that's
Yeah.
one that you probably need. It's more nuanced than perhaps what we saw here.
Yeah.
But anyway, I just wanted to highlight that. That's actually pretty common.
Beach.
He fell asleep in the sun.
Yeah, he was on the beach. I did that once.
Yeah.
Oh,
It wasn't that bad.
Maybe we should just lean him against the gurney or something, huh?
Mark? I passed.
I was gonna say is that his wife?
Yeah, I know. Why'd she look different?
I don't think she's necessarily different. I just think I was curious if it was like someone I knew from another show.
Oh, okay.
I am so proud of you. This is heartwarming, but could I get some help here?
So it's like that girl in the bikini in the pit.
Yeah, I know. He looks to be in a little bit more pain though.
Yeah.
I mean, I have done that once. You left me on the beach. You were supposed to wake me up, and you didn't. 2 hours later, I feel the water coming close to my feet. Yeah. Okay, in the hospital. The bathroom too.
I'm dying for every time
Man,
that's
you gotta get
happened.
accepted to the bar more often.
I'd be broke.
What's wrong with you?
I need to talk to you about your wife. She's got a spinal fracture and massive internal bleeding, and now she has what's called DIC.
Disseminated intravascular coagulation.
Did you and your wife ever discuss organ donation?
It's a nice touch from Dr. Benton.
Yeah.
And I think it's genuine. Like he's being genuine here.
When people ask us to react to ER, they never said it was gonna be sad.
Well, what do you think was going to happen?
I don't know.
He's senile. That's nothing new. You give him antibiotics and send him
This guy
home.
from Saul.
Yes, it is. I was like,
So he got his start in a hospital and he saw how to torture people.
He can be treated medically as an outpatient. We don't have the beds. If Svetic won't take him, he's out.
I'd never seen him in anything before Saul.
Okay, Malik. Grab the crash cart. Susan, we
Yeah,
got a
pause.
mayday.
That might be a little bit confusing because on the pit, I can't watch the gross scenes yet. I've seen many of the Saw movies, but that was before I had kids.
Okay.
And like after I had kids, I could no longer watch that kind of stuff
Yeah.
because I imagined it as someone's child. Anyways, I just had to clarify that in case people came over from the pit and like, what? She watched Saw?
I don't know that that connection was going to be made.
But that was my connection, okay? I was like, yeah, I actually did used to watch that stuff and be okay with it.
I can't put my earring. Hi.
Party on.
Party on, Wayne. But she just was just like, oh, I can't find my earring.
Well, what did you
I
want
would
to
have
do?
been like flipping out.
Oh, man. That's all the good stuff. I'm never going to live this down.
Well, big hospital. Maybe worth waiting to hear about it.
Hey, Mark.
How's it hanging? I'm a dead man. Carter.
Oh no.
Doctor.
Wait, is he asleep or has he got stomach virus?
Clear.
Looks like he's sleeping, or sounded like he was sleeping.
I know.
I've got a rash. I need a doctor.
Is that's not that same chick from? No,
I don't.
like the one that was.
Is it?
I don't.
Are you a doctor?
Me?
Yeah, I don't think it's the same word.
She's got a rash.
Can you help me?
Sure, I can try.
We sure? Oh look!
The bell.
I just smacked the thing.
I tried to get her to see our doctor for weeks, but she wouldn't go.
Lasix, Dig, KCL, Iserdil.
She's got AFib.
Oh.
Is she gonna be all right?
We may have to make a difficult choice. We're dealing with an impending respiratory failure.
Please, do everything you can.
We're gonna get blood gases first, and then we'll take it from there, okay?
Okay.
He's from National Lampoon's Christmas Vacation.
The old guy?
Mhm.
Oh really?
So you're in your 3rd year of medical school. Must be hard.
It's pretty demanding.
Must be very hard.
Are you sure it's not the same girl?
Afternoon, Dr. Carter.
Maybe.
Oh, hi, Dr. Lewis. Poison ivy. Pretty nasty case.
On her butt?
You don't mind if I stick around and observe, do you, Doctor?
Oh, he's doing fine on his own.
Yeah, I think it's the same chick. She probably went and sat in it.
Maybe he hasn't learned that you probably need a chaperone there for
Yeah,
that.
I know.
It's remarkably turned out as well as you did, isn't it?
Mr. Franks, I'm troubled with the results of your wife's blood gases. Her condition is terminal. If we put her on a respirator, we'd be prolonging her life in a vegetative state.
Oh.
We can make her comfortable. Give her fluids, antibiotics, let nature run its course.
You mean let her die?
She'd die in peace.
Put her on the respirator.
We'll hold off until we get another blood gas. Hopefully things will improve with the nebulizer treatments.
Oh, that's horrible. Like for both.
She has 13 grandchildren. Did you know that?
No, sir, I didn't know that.
I just thought you should know.
This is difficult because obviously, like, these conversations are real. These conversations do happen. It's hard to observe it, like, in this context because when you're in that situation, you've likely had a little bit more detailed interaction. You've probably sat down, kind of talked through these things a little bit. And honestly, one of the things that I would do in a situation like that, when, you know, it's certainly okay to say, look, we may have difficult decisions here to make soon. She's deteriorating. And actually, I don't even know exactly what, because he's not mentioned what the blood gases showed or any of that.
Yeah.
So again, without knowing exactly where we are medically to accurately prognosticate, a lot of times I would sit down and you start having that conversation, like, how many grandkids do you guys have? Like, that's a question that you would ask. It does show them that you do care about who they are. It's not going to change what the medical management perhaps suggests, but it is going to let them know that you care. So obviously this man feels perhaps maybe like they're just, you know, you're just the doctor who's used this as a patient, as a number, you know, as an MRN number, you know, like a medical record number, rather than the person that they are and the life that they have and the people that are potentially being left behind. But then you would ask, you know, did she ever say what she would want in a situation like this? You know, you're likely going to get the truth there. In a situation where they're hurting and they're scared, they may still choose against that. And it's complicated. It is. But I appreciate that the show is highlighting that. It's a very complicated issue.
So you're finally up.
What time is it?
7:30.
Boy, I must have really tied one on this time.
Yeah, you might have killed somebody.
Yeah. No, it sounds like he did. They're just not dead yet. Talking about organ donation.
I get busted again?
You don't remember?
No, not much.
The policeman went for a cup of coffee. He'll be right back.
Boy, I must have really screwed up this time, didn't I?
Yeah, a little bit.
You hit a family. The mother's dead and the daughter's in intensive care.
You're going to prison.
You ordered an angiogram?
Yeah, they haven't gotten around to it yet. Radiology's backed up.
Thank God for small favors. I think his abdominal pain is related to a urinary tract infection. He had a Foley catheter during his surgery. I'll write you a prescription, have you home in time for dinner.
Well, that's the same thing he said.
Oh, no.
Well, the next time you want to practice expensive, overly aggressive procedures, you do it on one of your indigent patients.
Your what?
Indigent, low social class.
Starts puking her guts out.
Honey, I'm sorry. I just, oh God.
Do you know what she ate?
I don't think she ate anything until the reception.
You're holding your reception at Gerber's Hofbrauhaus on 46?
Uh-oh.
That's where those German tourists ate, the ones from this morning.
How many guests are you wedding?
A couple of hundred.
Oh, God, I just got chills. No.
Have her blood gases improved.
CO2's up to 70. She's tiring.
So PCO2 up to 70. So yes, so she's retaining. So without exactly knowing her backstory here, what that means is that CO2 is what you breathe off, right? So as we breathe in, it utilizes it to satisfy tissues and deliver oxygen to the tissues. And then CO2 is the waste product that then blows off. If you're unable to effectively blow that off, you will become confused typically. And so we call that hypercapnic respiratory failure. You see it with COPD. You can see it in hypoventilation syndromes. This was before my time, the 90s, right? I think this is what this was.
I think it said 94.
But I don't know when BiPAP became an available tool, say in the respiratory therapy game, but this would be a perfect situation to put on something like BiPAP, which is considered non-invasive ventilator, essentially. And so it would not be the same as putting a tube down. You would put a BiPAP machine, and then that BiPAP machine allows or helps you to blow that CO2 off.
Okay.
And so this is what you would do as a bridge, perhaps before turning to something like intubation. But again, to be fair, I have no idea when BiPAP came out. I would have thought it was available in the 90s, but
was the BiPAP what was scarce during COVID? Is that what the
so no, ventilators in general?
Oh, just ventilators. Okay.
In general.
Right.
But yeah, BiPAP is a non-invasive respiration technique, and so that would be perfect in a situation like this to try to get that CO2 off.
I guess we'll have to look that up.
She's getting better.
Probably not.
I know.
She woke because we gave her fluids. Her respiratory problem is worsening.
I'm very tired.
Oh.
Are you in any pain?
I'm dying, aren't I, Doctor?
No, you're going to be fine.
Do you want us to put you on a machine to help you breathe?
Yes, she does.
I'm asking your wife.
We've already discussed this.
No.
Oh.
I don't want you to go.
So I've seen this play out before. Almost exactly this play out.
The image there that they had. Did you catch it?
What?
It was like a married couple, and then
they
like showed like like the beginning of someone's life and then the end of somebody else's.
Yeah.
You say it like it's normal.
I say it like it's beautiful. When you think about it's terribly sad. Yeah. But I think it highlights that, that sort of circle of life, so to speak. It's
not the Lion King.
It's beautiful writing, right? I guess that's what I mean by that. I guess I should be careful. I'm not saying beautiful. It's beautiful that death is not beautiful.
Oh yeah. Well, no, that was just like, wow.
Yeah. All right.
Let's continue.
A couple of hundred? Yeah, but not everybody had the potato salad. Only about
potato salad. You know what that means?
Nope.
All right, so I don't know if
that's what caused it.
Well, so yeah, they've all had food poisoning, which I think they kind of mentioned, but I don't know if they're going to cover this or not. But potato salad, it is almost undoubtedly Staph aureus food poisoning.
You love Staph aureus. I'm just kidding.
No, I don't love Staph.
I know.
So what this is a preformed toxin that they have ingested that was in the spoiled, essentially, potato salad. So the bacteria itself was unlikely present. This is what's interesting because it's actually not even technically infectious because the bacteria itself never made its way inside of you. It was the toxin that was released by the bacteria that found itself into this potato salad that then was consumed by all these people.
So it's byproduct.
A byproduct, yes. That's this toxin. an exotoxin, essentially, right? Because it's not one that is released or formed inside the body. And endotoxins technically are released by gram-negative bacteria, which we won't go into that. But the point is that is usually a very quick onset, sometimes within hours of consuming the contaminated food. Thankfully, it's relatively quick offset too. So people with this type of food poisoning don't tend to stay sick for very long, but it can be very violent, be very miserable, but then it does tend to go away relatively quickly. And really the only treatment is going to be supportive, IV hydration, things like that when you can. But yeah, probably something like Staph aureus, given that it was potato salad and given the duration of when these people likely consumed this. Good news is not contagious to the people around.
That's good.
That is good.
But all those
But
people
it is
at that
miserable.
wedding.
I'm going to write that down to talk a little more about that.
Just keep your head down, man. We'll be with you as soon as we can.
The bridesmaids over there.
Oh, gosh.
Bright pink.
D5 NSAIDs if they look like they need it, okay?
I don't want to eat potato salad anymore.
Accordions. They moved their wedding reception into our waiting room. Night.
They found him walking down middle of Halstead naked. He was still wearing his hospital bracelet.
Oh.
I have to feed my dogs.
I know you do. I want you to take him to psych services and check him in right now.
Well, what if they won't accept him?
Then I'll sign him into FedEx service.
Okay.
Yeah, I mean...
Yeah, come on.
This is clearly dangerous at this point.
You know, you should talk to Doug about Hathaway. It's been 2 months.
I did.
Why is he acting like this? They were together 2 years.
Oh.
She passed her bar. She was excited.
So were you, from what I could see.
You do not admit a patient to my service without a consult.
He needs psychiatric help.
Admit him to your service. Don't turf him to mine.
I tried to. Wirtz wouldn't let me.
Standoff.
Don't ever do that to me again.
What? This is just, yeah, I don't like that.
Yeah, you would like to think trying to help patients would not get so much resistance, right?
I know.
I'm sorry about what happened earlier today with the thrombosis patient. I think you were right.
Is that so?
Is that so?
I'll be sure to notify the New England Journal of Medicine that you concur.
Oh. It's like, man, I can't do anything right. You did save a life.
Yeah, of course you did.
Oh, God. He's like trying to be happy. I could, no. That music, everything, I'd be like, we're dancing.
I love potato salad, so I probably would have been sick.
Yeah, I like potato salad too, but I don't know if I'll eat it. I don't know. It's hiding Staph aureus in it. This story should have been closed.
I've been waiting for that fate had me created for.
She died.
Darling, down and down I come. Magic call love.
Oh, he's got a tear. Or Dr.
Ross.
Yeah.
He's thinking of that nurse.
That he didn't go visit. It's horrible.
I miss you too.
I do like that we get to see some of the like out of the hospital life.
The look on your face.
Well, it was a little embarrassing.
We could pick up where we left off.
What if Rachel wakes up?
Maybe not outside though.
I'll be back in the hospital in 2 hours, Jen. I'm sorry.
Oh, when medicine is life.
You're never gonna leave, are you? The hospital.
She's getting upset.
I don't know.
I need you, Mark.
I feel like she's being a little unfair, to be honest.
I love you.
I just feel like it's so important to find a job that you love.
Yeah.
Because you have to be away from your family during that time.
Yeah, I mean.
So imagine going into a job that you're miserable at and you have to be away from your family during that time.
Yeah.
Yeah.
Oh, what kind of car does Baby Robbie drive?
Jeep. God, she freaking.
How did you get?
So let's
Yeah.
go.
Okay, looked at the scene.
I live with my folks.
My place, then.
Okay.
What? Okay.
I guess I'm gonna do this.
I mean, he's a med student, so
It's poison ivy. It's not contagious. It's all right.
And from wandering around the north side naked, I just...
what kind of jersey is that?
Chicago Blackhawks.
Of course, you know that.
Hockey.
Want to scream.
Well, you can't solve all the world's problems.
Hold on.
Said.
Is that the psychiatrist?
He's very
Wait.
So,
They're married and they look happy.
some curveballs here.
They like what? Completely separate work and home life?
I mean, are they married?
I don't know.
I don't
or
know.
or maybe that she liked that, being talked to like that.
I don't think so. All right, so this episode's been full of some surprises.
Gosh, it's like an emotional roller coaster.
I know, but
in a different way.
But like I said, I do like we're getting a little bit of outside the hospital
I
feel.
know.
All right.
You have to be very careful how you deal with consults. You can get yourself in real trouble.
I just want to make a difference.
Not everybody's gonna be as understanding as I was.
Oh, yeah.
Is that what that was?
Yeah.
It's one of my best qualities. Well,
Yeah, no, that wouldn't jive for me.
Oh, is this the...
Sorry, what?
Oh, he's going
No,
to
this
see
is...
her.
Yeah, okay, so sorry. This is...
Dr. Ross.
Oh, Helen? Can I come in?
No, you can't.
Oh,
What is that, her mom, you think?
maybe.
Who is it, Mama?
I asked him to leave.
It's okay, Mama.
Yeah, I just came by to see you. Say hi. It's good to see you.
Okay. All right.
Dr. Benton,
What is it?
EMTs are on their way in. They think it's a ruptured bowel.
Ruptured bowel. Ew.
Yeah. Oh,
Is
it's
it that
this
guy?
same guy?
His abdomen's rigid, extremely tender. To the CBC, tried to cross 6 units to stop an NG. Call the OR, tell them to prep for an exploratory lab. Gunner, listen to me. Don't worry about a thing. Everything's gonna be fine. All right, on my count, we've done it before. Here we go.
On my count, we've done it before.
I need to drop an NG, get a chest X-ray, and abdominal, make it a portable. Let's go.
Not that he wanted to be right, but
No,
but he's validated now.
Panning back on the chaos of the ER.
Yep.
All right.
Well, that was an incredible episode.
It was really
Not
good.
very many things make me cry. Absolutely try everything in my power not to cry.
Yeah, no, look, I mean, I think people probably rightfully have wondered if you were soulless.
Probably.
But, yeah, a really, really interesting episode.
Mm-hmm.
A lot to go over here, medically and otherwise, right? So I just can't get over,
The psychiatrist?
Dr. Carter
Oh.
going home with the patient.
Yes.
Who had,
She's clear. What is that called when you have a sex addiction?
well, so like we made the same comment about the
did.
girl in the first episode with Dr. Green, who's like exhibiting that kind of histrionic personality kind of trait. Maybe. I mean, that's not, I obviously can't make a diagnosis based on like one observation, but that sort of hypersexual, that's a characteristic at the very least, we would say. So that's interesting. Yeah. Although again, poison ivy, for those of you who don't know, is not contagious. So
Unless you both touch the plant.
The plant is contagious.
Yeah.
Unless I suppose oil.
Yes,
is
the
still,
oil.
but,
Like if you do this, I go like this. Maybe.
It's unlikely that would be the case. So yeah, so technically, I mean, he's fine to go do whatever he's about to do. I wonder if we'll touch base on that next episode.
I don't know.
Yeah, the whole psychiatry, and I can't remember her name. Is it Monica? Or I can't
don't know.
Offhand,
I don't remember.
Anyway, that was also a bit interesting. So I wrote down a couple things to kind of talk about a little bit more detail. So Staph aureus, I know, to kind of close the loop on that, because I think this is worth knowing. So those toxins, by the way, are very heat stable. And so heating them up will do nothing to kill them. If you have food that has been spoiled and then you're like, oh, let me just heat it up again to temp or something. Nope. Won't
You
matter.
wouldn't heat up potato salad anyways.
Well,
yes.
Yeah, but like the idea is if it is contaminated, no amount of heating is going to actually do anything. The other thing too, I think that's worth mentioning when it comes to food poisoning. I know I've mentioned this maybe in an episode of The Pit, in an episode of Cells at Work, if you've watched any of that. But the idea, so how we rehydrate somebody who's dealing with massive GI loss, because while it makes sense to drink water, you can imagine the gut is shedding water. Like that's why, I mean, you're having diarrhea, you're having vomiting, water is just flowing through the gut without being absorbed. And so drinking water is not actually all that helpful. IV fluids can be helpful because you administer the fluid directly to the bloodstream, which is where you want it, as opposed to having to absorb through the stomach into the bloodstream, which is how we would do it if it was, quote,
You drink too much water, then you start peeing out your butt.
So we're a little slap happy tonight. But so really what you need in order to effectively hydrate is actually glucose, because there is this kind of glucose sodium co-transport or system in the gut that requires this glucose in order to then take up the fluid. And so like Pedialyte, most people are familiar with Pedialyte, is probably one of the most perfect things you can do for rehydration because it's that perfect ratio, say sugar and glucose, salt and glucose. Gatorade can be useful, but Gatorade's a little too sugary, and so we don't tend to like that. And then like the zero sugar products are actually pretty useless for that because they don't have actually the glucose that you need to take up the hydration.
What if you took Gatorade and watered it down?
Yeah, I mean you could. I mean, you can do Gatorade.
Yeah.
I mean it's just not maybe ideal.
Yeah.
But you certainly can. You take apple juice and water it down, like half part apple juice, half part water. That could sometimes be an effective measure. There, some people have kind of had the old like wives' tale of trying to like take sodas, for example, stir them up to kind of make them flat, and that's sometimes the thought was that can help. That honestly is probably not a great idea if you have some of these other remedies at your disposal, because the carbonation frankly still can be somewhat problematic in those. I think that's important because obviously we see this type of thing all the time, whether it's norovirus, which is god awful, or any of these things. Stress ulcers. I want to touch base on that from episode 1 because I thought they might go into it and then I kind of forgot about it, frankly, and then I was thinking about it again as I was like recapping episode 1 in my mind. And so I think the notion, it wasn't explicitly stated, but the notion I think is that this child developed an ulcer from stress. And that's sort of a myth that ulcers can be developed specifically from stress. There's no evidence to support that. Now, stress can make ulcers delay heal, because obviously stress can affect your immune response, and then so you may actually get delay healing of ulcers or other things, frankly, due to high levels of stress. But there is such a thing as a stress ulcer, and so in the hospital setting, we actually give people Pepcid typically as part of this, quote, stress ulcer prophylaxis. And this is not due to like mental stress. This is due to significant physiologic stress. And so when you're septic or something like that physiologic stress can certainly precipitate with an ulcer. And then ulcers also, just to kind of go down that pathway a little bit further, common instigator of this would be things like NSAIDs, so ibuprofen, Aleve, naproxen. Those are commonly, so anytime your doctor tells you maybe to be a little bit careful with that, they're usually telling you that for 2 reasons. 1, because of the potential for stomach lining irritation, and 2, because of kidneys. And so those are the 2 things we watch out with chronic NSAID use. And then, of course, the Heimlich maneuver, you wanted to talk about that.
Yeah, I mean, you had to perform it on me once.
I do remember that one.
You remember that we were eating Skyline?
Yeah, Skyline.
Or just chili spaghetti we made?
For those of you not familiar with Cincinnati, or that, I don't know if we've mentioned we're from Cincinnati, Skyline chili. I think most people are familiar with Cincinnati style chili. It's the best thing that's ever existed.
I tolerate it. I had been dealing with reflux, but didn't realize that untreated reflux can cause choking, right?
Well, yeah, I mean, people choke from reflux.
Yeah, I didn't know that.
Yeah. Aspirate.
I guess I'd had stuff come up at the same time that I had a mouthful of noodles, and it sucked down and got stuck. And the funny thing about this is I was like leaning over thinking gravity would make it fall out. And I was leaning over your food, and you were like, go over the trash can if you're going to spit your food out. And I had to like do this. You're like, oh my God, you're choking. Okay, I'm sorry. Like the whole time he's performing the Heimlich, he's like, I'm sorry. I'm so sorry. I didn't know you were choking.
Well, I mean.
And then you were like, okay, I'm going to do it. I'm going to go for real. And I like had to start hitting you. Like it was like dislodged, but I was, I couldn't really like talk yet, but I had to like elbow you in the side because you were about to like break my ribs.
She survived.
I did.
I do remember that. I thought you were like spitting on my food. I was like, what are you doing?
I know.
And I was like, oh, you're actually choking. No, I was way more calm than what you
You
just
were.
described.
You
Yeah.
were. That's
Yeah.
just how I remembered it.
Got
Because
it.
that was how my brain was playing it out.
I mean, I got up slowly. I think I checked a couple emails.
You probably
I
did.
started a cup of coffee.
Yeah, you probably
And
did.
then came over. Who did?
Scarlett, our
When?
middle child, she was like year and a half old, 2 years. I think I was pregnant with our youngest, and she had gotten a hold of roll. I don't know why that girl just loved to eat bread. Like she had gotten a hold of a bunch of rolls, and she had just eaten them and didn't really chew them. And I just remember, I was like, Chad, she's choking, she's choking. And you came over, then you just put her like this, and you were just going like this calmly, like on her back. And I'm like freaking out, and then all of a sudden this just like tube of bread. Like,
Yeah, actually, okay.
You remember that
yeah,
now?
I do remember that. Yeah, so that maybe is important to highlight that there's a difference in how you perform the Heimlich with children,
Yeah.
particularly small children and adults, right? So typically adults, should we display?
No, that was horrible feeling. I mean, obviously I was
Honestly,
choking.
honestly
so.
though, in all reality, it's very important to know these maneuvers. And so if you don't know them, maybe just go do a quick YouTube video search, like how to perform the Heimlich on adults and how to perform it on children. Because I mean, we can't kind of probably highlight here,
this
but
under the
where you come
diaphragm.
around and then you thrust, and and it needs to be pretty like you should be performing this with the intent to do something, right?
Yes.
Because it's not like being gentle about it.
Which you were a little bit more gentler the first couple times, and then you said it's going to get a little. You warned me that it was going to be a little, and that's when I elbowed you in the side. Like I don't need it anymore.
Yeah. So, but it's important to know that, and with young children too, you don't so much do the Heimlich the traditional way. It's more of those kind of what we call back blows. That's going to be more effective for children. And then also, if you don't have somebody with you and you are choking, try to find a hard surface, frankly, and kind of thrust yourself against it in that area, the same area that we would perform the Heimlich.
I've always heard a chair.
Yeah, and maybe put your hand against it to kind of buffer it, because you certainly don't
go
want
like into the countertop.
You don't want
or
something like sharp. I mean, obviously, survival is the most important thing, but also you don't want something penetrating right through your stomach or something. And so maybe having that buffer there and then finding something to kind of ram yourself in. So yeah, I think that was all we got.
All right.
Anything else?
No.
No?
Nope.
All right. Well,
Good.
I'm hooked.
I
That
know.
episode was very...
That was an incredible episode. I wonder if that one won any awards or anything.
I don't know. That's probably what... Oh, by the way, too. Okay, sorry. I want to backtrack one more time. We had heard... Some of you guys had kind of filled us in on that the nurse...
Yes.
That I guess she was originally maybe supposed to die, and then based on the audience response, because I guess the pilot aired several weeks before, maybe even several months before like episode 2, and so they were able to maybe pivot their writing in order to,
Because she should not have survived with that
so
positive.
based on her physical exam in episode 1, it would have been very unlikely that she would survive. Certainly that she would survive without major brain damage.
Yeah.
And so, but yeah, I guess based on the audience reception, it was like, hey, nope, we need to bring her back, which makes sense because we recognize her.
Yeah.
So it'd been unlikely to recognize her from.
I think someone said she was from Sopranos too.
Oh, which
I know you haven't seen.
Don't come at me because I know somebody was pretty upset that I hadn't seen Sopranos. I'm gonna be honest with you too, because we started watching House, which we've had some copyright issues with that. So by the time this comes out, hopefully that's all sorted. But people might be really mad at me for saying this, but I've never seen Sherlock Holmes, and so
I haven't either, actually.
But anyway, maybe we'll watch it. We'll see.
Yeah.
All right, guys. Well, hey, this has been a lot of fun. Consider coming back for episode 3. We'll get started on that soon. Till next time, have a good night.
See ya.
I am Dr. Todd.